Hi, this is Dr. Praveen Ramachandra, endocrinologist. In this video, I will be talking about the role of exercise, physical exercise in type 2 diabetes and also we can say obesity. In type 2 diabetes mellitus, I would say exercise is a type of medicine. If you do exercise properly, I always tell my patient that it is equivalent to 1 or 2 medicine. So effective it is. So why exercise is essential in type 2 diabetes? That's the question. So type 2 diabetes is actually caused by not moving much. It's a lifestyle disease. So the people who are desk job, not moving around much, who are working from home, who are housewives, don't go out much outside, don't have physical activity. That's what causes type 2 diabetes, correct? So type 2 diabetes, what happens when a person do the exercise, the insulin resistance improves. The insulin sensitivity improves, so insulin resistance actually comes down. And it reduces your belly fat. Belly fat is more important because it's a metabolically active fat, belly fat. And it improves hypertension also. Your BP also becomes much better. And it does help in managing your cholesterol. You know that type 2 diabetes people are more prone to increase in cholesterol level, blood cholesterol level, and it improves the heart also. Heart becomes much more stronger. The small heart can pump more effectively with fewer beats. So heart also becomes better in type 2 diabetes if they do physical exercise regularly. And another thing is there is a second heart, I say actually. The calf muscle. When you walk, the calf muscle becomes very powerful and healthy, because of which the blood from the foot get pumped to the heart. So that's also very important. And I always tell calf muscle is second heart of the body. Okay, and exercise improves the endorphins. Since it is improves the endorphin, the patients will have better mood, and sleep will become better. So weekly exercise regimen, if I have to tell you, how to do, how much exercise is required. We classify the exercise into two, aerobic and strength training. What is aerobic exercise? Aerobic exercise are the one which increases your heart rate. They are known as aerobic activity, where the oxygen consumption increases. Okay. So aerobic activity you have to do per week, if you say some of 150 to 300 minutes per week. So if you divide per day, it up to 30 to 45 minutes per day walk is required. If you do 5 out of 7 days a week also fine. If you do 7 days, really good. Otherwise, at least 5 days a week you have to do that. Or if you do some vigorous activity like jogging, cycling, then probably you can shorten the duration also. Aerobic activity means walking, jogging, cycling, swimming. These are known as aerobic exercise. Okay. Then diabetic patient also has to do strength training. Strength training is very important because it improves your muscle mass. Muscle mass improves means your basal metabolic rate goes up. Okay. So strength training means push-ups, pull-ups, sit-ups. This is with your body weight only when you do the lift and do the exercise. That is known as strength training. And also dumbbells you can use. You can have gym equipments which some strength training dumbbells and pulling, pushing, the gym equipments. They also can have. And you can do flexibility exercise also. Flexibility exercise means yoga or tai chi. Yoga doesn't help diabetes in other way. It only helps for the flexibility. So that also you can do. Warm up exercise, that also you can do. And very important thing is age appropriate exercise should be there. What the 18-year-old can do, 65 may not be able to do it, correct? So before doing, you have to meet your endocrinologist and tell. Then your endocrinologist will assess what the BP, what's the age group you belong to, and what kind of exercise is suitable for you. He will explain to you. And any age, if you take 18 to 45, if you take a group of age group, if you fall between the age group of 18 to 45 years of age, I would say you have to do the aerobic activity, aerobic exercise, the at least 30 minutes per day, like, and resistance exercise at least 2 to 3 days a week, and core flexibility I can do alternate day, that's fine. And if you are between 45 to and 65 years of age, then brisk walking of 30 minutes is fine, and strength training you can slightly cut down actually. Sudden high intensity workout may not be required in this age group, and if you are more than 65 years of age, walking is still very good, you can keep doing that, and balance exercise to prevent falls is important in this age group, more than 65 years of age, and some amount of guided strength training is required, so that after 65 years people start losing muscles, we call it a sarcopenia. To retain the this thing, some guided strength training is also required. And before starting the exercise, we need to do complication check actually. Any diabetes can be having hypertension, and if the BP is very high and you start doing strength training, this can further increase the BP and can have heart attacks and strokes, and also BP has to be monitored and optimized before you go to exercise. And if you have any heart disease, diabetes, most common cause of heart disease nowadays is diabetes. So when you are before starting the exercise regimen, I recommend you to visit your doctor. He will tell you whether you are cardiologically fit or not, whether the heart is fit enough to do the exercise or not. And neuropathy, the diabetic foot issues, nerve problem, and in the eye, retinopathy, if there is a bleeding is there, and kidney problem is there, nephropathy. All this we need to first check for the complication, then only have to do the test. So another problem is what happens is whenever you go for exercise, the thing which can occur is sugar can go low. So when you do exercise, body consumes glucose level, and that causes low sugar, hypoglycemia. So always carry a pouch of glucon-D powder, glucose powder, or sugar with you, or fast-acting carbohydrate, milk, chocolates, and all is fine. And you should not go to if you're taking insulin within next 2 hours of taking insulin, you should not go to exercise, because sugar will be going down because of the insulin action. You can get into hypoglycemia. Hypoglycemia means low sugars, correct? And during exercise, if you feel any tremors, dizziness, low sugar symptoms, you have to take a break and take minimum 15 grams of carbohydrates. And after exercise, you some protein shakes or complex carbohydrate you can take. So, simply if I want to say, if the sugar is less than 90, eat something, then do the exercise. If the sugar is between 90 mg of deciliter and 250 mg of deciliter, you can do the exercise, no need to snack before that. And if more than 250, if the ketones are positive, then also you should try to avoid. Safest, I would say, between 90 to 250. And second comes is the weight target. What are the weight targets you have to achieve? Through this exercise, you are supposed to keep first 3 months, this is the weight you are going to lose. Next 3 months, it's a graded weight target your endocrinologist will give you. Okay? With this, I conclude. Thank you.